Are Republicans waving the white flag of surrender, or are they still fighting it?
Oh, definitely still fighting. No, look, it's a bad law. If Obamacare worked, then why do we find that of the 8 million people they say they've signed up, we think only 25% were previously uninsured? You know, why do you look at what the Congressional Budget Office says, which is a nonpartisan group, which is that after 10 years of this law, over $1 trillion in spending, 19 new tax increases, all the mandates, still 30 million Americans are uninsured. So we think we can do better. So the point is not just to repeal it, but to replace it with legislation that does give people more opportunities to get the coverage they want.
So you're saying
doctors.
The phrase repeal and replace is still alive and kicking?
Definitely. And look, if we get the majority in the United States Senate, I think we should work with the House to pass legislation that both repeals and replaces with better ideas. It may take a new president to ultimately do this, because one assumes President Obama is likely to veto what we're trying to do. But no, we've got, for the sake of the American people, American families, our economy, we've got to change this law. We've got to repeal it and replace it with something better.
Come back to this idea about reforming the exchanges that Kathy McMorris-Rodgers is apparently talking about. Is that part of your strategy? Or if you were to take the Senate, how would Obamacare change?
Yeah, look, I don't think the exchanges are working. As I said, we think that fewer than 25% of those who have signed up actually were uninsured previously. In other words, you have 5 million people who have lost their coverage. And it's the coverage that they wanted for themselves and their families. So these mandates that are being put in place are not things that most people want. In other words, they want something that works for them and for their families, and they're increasing the cost dramatically. So I personally think it's a failed model. I think we need to get rid of it. And we need to put in place better policies that actually allow people to keep what they have, but also help people to get coverage who can't afford it.
Understand the point you're making. But again, on repeal and replace, what part of the law was acceptable? What would you like to keep?
Well, look, there's some stuff in the law that has to do with preventive and wellness. I don't think it's very effective, but I think Republicans are interested in that. I know I'm very interested in this idea of health savings accounts, as are most Republicans. They made health savings accounts even worse, took away some of the tax advantages in health savings accounts. So overall, Bill, there's very little I can point to in there that's actually positive. But the point is, we have better ideas, and we have ideas to get people coverage, to keep the costs of health care down, which is the key issue, and, you know, to allow people to have what they want.
Bottom line, when people say you're waving the white flag?
No.
That's not true.
No, and we can't, for the sake of the American people, American families, our economy. One thing that's happening with Obamacare, as you know, is more people are going to part-time, which is bad for the economy. Companies who are concerned about getting into Obamacare are keeping their numbers down because there's a cap. You know, once you go over a certain number of employees,
we're going to talk about that in a little bit too.
So these are bad for the economy too. So this is not a good law by its own standards, its own metrics. It doesn't work because, again, after 10 years of this law, the Congressional Budget Office tells us still 30 million Americans would be uninsured. So after all the new taxes, all the new mandates, all the new costs, it just doesn't work.
Senator,
doesn't live up to its billing.
Welcome back to New York. Rob Portman
with
us in studio.
All right, take care.
Talk again.